By the end of the presentation, you will be able to do the following. List the reasons why research and evidence-based practice is critical in the nursing world. Describe the differences between research and evidence-based practice. Define how to approach and critically read a research article. Explain the steps involved in evidence-based practice. The significance of nursing research is to stay abreast of new information, to help us get out of the old comfort zone that we're used to in our care, to design new and innovative programs. Also, nursing research is significant because it is the scientific base that empowers nursing, and it helps us meet societal challenges and changes. Is research and evidence-based practice the same thing? It is important to differentiate between research and evidence-based practice. Research is the systemic, rigorous, logical investigation that aims to answer questions about nursing phenomenon. Research follows the steps of the scientific process. Research studies are published in professional journals, read and assessed for their use in clinical practice. Evidence-based practice is the collection, interpretation, and integration of valid, important and applicable patient-reported, clinician-observed, and research-derived evidence. We could use smoking cessation as an example. Based on a comprehensive literature search of all the research on smoking cessation, conclusions were drawn regarding the benefits of smoking cessation. This is evidence-based practice. The goal of evidence-based practice for you as a nurse is to use research as a foundation for your nursing practice. This is the significance of nursing research to the profession of nursing. Responsibilities of nurses today. How do nurses make a difference? Nurses must be accountable for quality of patient care. For example, evidence-based practice should guide us. Today, there is an era of consumerism. The internet, high healthcare cost, quality of healthcare is questioned. Nurses must document the effectiveness of their services. This is very important in today's world. The nursing profession's role will be determined how consumerism and employers perceive our value. And you know that if you're working as a staff nurse or a nurse in a hospital, nursing home, whatever, that there are patient satisfaction forms that are filled out, and this is very important to the nursing profession to document what we do. So, nurses must be able to evaluate research reports for relevance in their own clinical practice, to apply the best evidence to your practice. For example, to prevent central line acquired bloodstream infections, we now use chlorhexidine when changing triple lumen catheters as opposed to betadine. This is an example of evidence-based practice in the clinical situation. Nursing research links theory, education, and practice. Ask yourself, how will the theory of this research course relate to your nursing practice? This course will give you an understanding of the research process and help you become an intelligent consumer of research. You will also develop skills to critically evaluate research, which will prepare you for evidence-based practice. Both nursing theory and research are related since they advance the knowledge base of nursing. Importance of nurses. Yes, we are very important. Nurses have a strong voice in shaping public policy, especially now in an era of healthcare reform. The state nursing associations and the American Nursing Association have legislation cohorts that as nurses we could all join and voice our opinion. Research data provides evidence that supports or refutes health care. For example, smoking cessation and the association with prevention of lung cancer. We also live in the information age, research is disseminated by web as well as print, and it is not only us as healthcare professionals that are checking into any new health information. Our patients are on the internet too. Another important role of nurses is that nurse researchers are asked to give congressional testimony at government hearings. For example, nurses have given congressional testimony on childhood obesity and autism. There are two types of research, qualitative and quantitative. We will see and discuss the differences between these two, and we will discuss qualitative research first. Qualitative research answers a question about the understanding of the meaning of a human experience. Interviews and focus groups are used to collect the data, and data is collected with open-end questions. For example, what is it like becoming a widow when you are pregnant? Or what is the lived experience of having twins? With qualitative research, data is in the narrative form rather than numeric. It reveals subjective accounts of our participants' experience. In the qualitative research process, participants are interviewed in a natural setting, like their home. There is no statistical analysis, no hypothesis, no independent and dependent variables in qualitative research. So the difference between the two types of research is qualitative research looks for meaning. It has a research question but no hypothesis. Quantitative research has a hypothesis, objective, or research questions and uses statistics to analyze the data. Another type of research is quantitative research. Whereas qualitative research looks for meaning, quantitative research uses research questions and/or hypotheses that describe phenomenon, test relationships, assess differences, and seek to explain a cause and effect interaction among variables, and the effect of the intervention on the intervention. In qualitative research, data is collected with instruments or tools. Objective numeric data is collected and analyzed using statistical analysis. Another type of research that you will find in the research journal are systemic reviews. With systemic reviews, investigators find all the relevant studies on a topic, and the research articles are assessed for quality. The researchers present a balanced, impartial evidence summary of the findings in this type of research article. It is also called a meta-analysis, a meta-synthesis, or an integrative review, and there are a little differences between these three. In a meta-analysis, they use quantitative research studies and they present the results summary using statistical analysis. In a meta-synthesis, they use qualitative research studies and they summarize the findings. An integrative review of the literature is done on a specific area or topic without statistical analysis. Clinical guidelines are practice statements which help nurses make healthcare decisions for specific situations. They are usually developed at a national level or by healthcare agencies or organizations. For example, the CDC has clinical guidelines for hand washing. The types of guidelines are consensus or expert developed guidelines, for example, using 2 forms of ID for medication administration. Evidence-based guidelines are based on research findings, such as ventilator-assisted pneumonia precautions on ventilated patients. And what they recommend for this is the head of bed elevated, H2 blockers, mouth care, and also a sedation vacation. And that's a good example of an evidence-based guideline. Research studies are hard to read and boring, so you may ask yourself, how will I ever learn to read and understand a research article? The answer is using critical reading. Critical reading examines ideas, inferences, assumptions, principles, arguments, conclusions, statements, beliefs, and actions. You must know the research process to critically read a research study as well, and know the criteria for critiquing the research. And you will learn this in this course. You must consciously think about what you read, do, and write, and question the content, see how things measure up. Simply put, critical thinking is questioning. The process of critical reading involves the art of making one's thinking better, clearer, and more accurate. Start by reading the research article 3 or 4 or more times. Keep your research book by you as you read, so you can identify concepts and clarify unfamiliar terms while you're reading the article. You must question assumptions and rationales and determine if the supporting evidence is applicable to your practice and is valid. Critically reading a research study to understand it involves the following steps or processes. First is preliminary reading, or skimming. It is the first step to become familiar with the article. Keep your research book with you to look up things. Read the abstract and the title of the study first. Next step in critical reading is comprehension, in which you understand the researcher's perspective, their purpose, or their intent for the research. Remember, you are looking at the researcher's perspective, not your perspective, with comprehension. Next step is analysis. Ask yourself questions. Break it into parts. Use critique criteria. When you're reading a study, highlight or write on your study. Lastly is synthesis. That's when you put it all together, make sense of it, explain relationships, and you look at the findings. This helps you see if you can apply the research to your clinical practice. You want to be able to summarize the study in your own words and look at the study's strengths and weaknesses. Here's a question. Which stage of understanding using critical reading is demonstrated by a reader who looks up unfamiliar terms and highlights main concepts? And the answer is preliminary understanding. You must become an intelligent consumer of research by critically reading and critically thinking. So the final step when reading research articles is to decide how and when, if you could apply your study to your practice. Evidence-based practice uses the best evidence with your clinical expertise and the patient's values and preferences to make your clinical decision. You must also grade the strength of the research evidence by looking at its quality, quantity, and consistency. The final step in critiquing research is asking, how will you apply the research results to your clinical practice? In making this decision, you must assess the strength and evidence of the research studies, which are graded from level 1, the strength, all the way down to level 6. With level 1, there are meta-analysis or systemic reviews, which we talked about, of randomized controlled trials or experimental studies, and these are the strongest, provide the strongest evidence. Next is level 2, randomized controlled trials or experimental studies. With experimental studies, there is a randomization of subjects, there's strict control of the research methods, and manipulation or doing something. For example, giving an intervention of a back rub to see if it has an effect on anxiety. And because of the strict control, randomized controlled trials or experimental studies are level 2. In level 3, we have quasi-experimental studies, and these are experimental studies that don't have either randomization of subjects, and they usually use convenient subjects, and it is not as strictly controlled as randomized control trials. However, these are strong studies rated at level 3. Level 4 studies are non-experimental studies, such as a survey or a correlational study. Level 5 are case reports, program evaluations, and qualitative research. Because these are subjectives, they are a little bit down at level 5 on the strength of evidence of research studies. And last is level 6, which is the opinions of respected authorities. When assessing strength, you must look at the quality, the extent to which a study's design, implementation, and analysis minimize bias. You also must look at quantity, which is the number of studies that have been evaluating the research question, and including the sample size across the studies. And you also want to look at consistency, which is the degree to which studies have similar and different designs, yet the same research question and similar findings. When you're looking at a research article versus a clinical article, you will find that a research article follows the steps of the research process, as opposed to a clinical article which just presents a case scenario or information on a disease entity or other subject. How are research articles organized? Research report components include the following: the title, an abstract, an introduction, literature review, purpose of the study, a question or hypothesis, a theoretical framework or conceptual framework. Other parts of the research study include the methods section, which has the research design, the sample, the procedures, the instruments, and also goes into ethics. And also the results section, which contains data analysis, discussion, conclusions, and nursing implications, as well as references. We will go into each part of the research study individually. What's in the abstract? The abstract contains the concise main parts of the study. So you're going to find the purpose of the study, the variables, the research question or hypothesis, the background of why they're doing the study, the methods telling you briefly what they did and the instruments, as well as the results and the conclusions. Look at the research study in the ebook for Module 1 and identify the parts of the research study as I explain what each part consists of. It would be helpful to download and print a hard copy of the study while you're doing this. Where do I find the identification of the research purpose? You can find the purpose of the study in any of the following sections: the introduction, the abstract, at the end of the literature review, or at the end of the conceptual framework section. While you are reading the research study for Module 1 in the ebook, find the purpose of the study and highlight it or underline it. The literature review and the theoretical framework are sometimes merged together without a heading. Other times they have headings, such as literature review, conceptual framework, or theoretical framework. You may also ask, where do I find the hypothesis or research question? This area does not have a separate heading in the study. It is usually embedded in the intro or the background, or you can find it in the abstract. In the results or findings section, the researcher states whether the hypothesis was supported or not. And not all quantitative studies have hypotheses. They may have a research question, objectives, or aims. Please note, research studies have questions or hypotheses. Qualitative studies just have research questions and purposes, no hypothesis. Where do I find the research design and sample? Both are found in the abstract with the purpose statement. The design is found in the introduction to procedures or methods section. The population or sample is in the methodology section under samples, subjects, or participants. Look for these in your research study from Module 1. What does the methods section contain? The methods section is usually lengthy, and the section contains the research design, the sample, the instruments and their reliability and validity. The instruments can also be under instruments or measures. In addition, the methods section contains the procedures and the data collection methods. Most time, it's under the heading of procedures. What are the other sections of the research article? These include the results or findings section, in which statistical analysis or qualitative themes are found. The discussion section sometimes has findings in addition to discussing the significance of the study. The recommendations and implications section of the study gives the study's limitations, suggestions for future research studies, and suggestions for nursing practice. In summary, the steps to develop an evidence-based practice intervention include the following. The first step is to be able to critically read the literature, which includes research studies, clinical articles, and clinical guidelines. Other steps to evidence-based practice include critical reading, critical thinking, reading widely, understanding scientific principles. You must be an intelligent consumer of knowledge, and by evaluating research studies, you can develop evidence-based interventions. This is the end of the presentation on integrating the process of research and evidence-based practice.